Wavical is an award-winning data and analytics company based in Chicago with a national presence. As a provider of award-winning cloud data, analytics, and AI solutions and services, Wavical combines deep technical expertise and industry knowledge with the proprietary automation tools to support the rapid shift to modern data architectures, real-time insights, and AI. Wavical Data Solutions is proud to grow through almost 100% referral. With solid delivery reputability, proudly leveraging the ability to meet clients where they are to unlock the power of data. Wavical Data Solutions.
Hello, I'm Dr. Beverly Wright, and welcome to Tag Data Talk. With us today, we have Bhavna Mehta, AVP of Information Services Data Analytics at Cincinnati Children's Hospital Medical Center. And we're talking about leveraging AI technology in healthcare. Welcome, Bhavna.
Thank you, Beverly. It's a pleasure to be here. I'm excited.
Yay. Well, let's start off with a little bit of background on you. Why are you so cool?
Oh, it's funny. I don't think my kids would ever ask me that question. But I guess because I'm not afraid to ask why.
Love it. Very nice. So tell us more about your background.
So I'm at Cincinnati Children's Hospital. I've been there for almost 25 years now, so I've seen a lot of growth.
No way.
Yeah.
Has it been 25 years?
Yes.
Wow.
Yes. Not officially. I started as a consultant, but I always count those days as well.
Incredible.
Yes. So I've seen a lot of growth and a lot of change, both in terms of technology and the industry, healthcare industry overall.
Yes.
I started in application development. So I, wrote applications to collect data.
Nice.
Then I moved into application integration. So, kind of moving data between applications. Then I moved into our quality department, looking at this kind of thing, looking at more how data was being used to deliver care or improve care. And I think that was my first foray into really thinking about the potential and opportunity. And now I'm back into IT, but really looking at more data analytics overall and thinking how we can leverage data to continue to transform care.
25 years. I'm still stuck on that. That's amazing. Well, very good. I bet the transformations have been incredible. Now, 25 years ago, was it called Children's?
Yes.
Oh, it was still called Cincinnati Children's Hospital. Okay.
It was called Children's Hospital Medical Center of Cincinnati.
Oh, they moved
something like that. They moved the
back.
Cincinnati up. Yes, exactly.
Moved it to the front. Okay.
Yes,
Cool,
yes.
cool. I'm super excited for this conversation because AI in particular is such a great opportunity, has such a great time right now for improving healthcare. So tell us about, just to set the stage, what's going on in healthcare?
There is a lot of opportunity in healthcare, especially in the delivery of healthcare. I think AI has always been used in healthcare from a research perspective. So when you think about, the huge journal of medicines and the publications and really the discovery of new treatments and cures, we know that that's been happening. And, there's been a lot of data that's been processed, clinical trials, et cetera. But I think the opportunity we have now is one, to shorten that cycle of taking it from bench to bedside, because that usually took a long time because of, technology not being ready or our compute not being available, technology in different ways, right? Different types of data. But with that, I think the complexity of data has also increased over time, as we know, with the technology evolution. So now there is a lot more opportunity to think about in terms of predicting, say, trajectory of care or diagnostics or screening or operations in terms of even reducing clinician burden. Because one of the things I think we've done with increasing technology and using electronic medical records, if you will, is that our patients, our physicians are probably spending a lot more time with the computers, right? So you would go into a doctor's visit, and there are times when the doctor is really entering notes into the medical record as opposed to spending time or looking at you directly and talking to you.
Right.
So I think there's an opportunity there to use AI as a tool to eliminate or reduce that clinician burden so we can increase that human touch or give back that human touch that care really needs.
And we can all relate to that because we're sitting there in front of our medical provider and he's taking notes and not even looking at you or what seems to be not listening. And so, but I hear you. It sounds like what you're saying is on the research side, AI and machine learning and data science, at least to some degree, have been there for a long time because clinical trials, because research, disease, all those sorts of things. But now we're seeing it to improve operations. And then what did you call it? Bench to bedside?
Bench to bedside.
Yeah.
So bench is the research side. And how do you really take something that is discovered and put it into the clinical workflows? Historically, it has taken 17 years.
Oh,
it's
wow.
15 to 17 years is the time that it takes or it has taken,
right.
before where we are. But now I think with the technology advancement, we have the opportunity to speed that up.
How about that? So the research that's already been done for decades is now getting implemented much more quickly. And it sounds like you're also saying that the operations in general are improving because of data science and AI. You mentioned scans. I want to come back to that one in a second. Scans and the way that we're capturing data on patients. You mentioned patient experience. The only thing I didn't hear you mentioned was equipment, which I'm sure healthcare equipment is using quite a bit of data science and AI.
Absolutely. So think about the telemetry, right? The patient alarms or, say, ventilator devices or heart monitors. All those are transmitting data. And we can use all that data to detect abnormalities or risk or trajectory. So that's a lot of data science going on, even in terms of alerting, when someone needs to be alerted there's a alarm or there's a raise, there's a vital, suddenly the vitals go up or something like that. So yes, there's a lot of data science, a lot of potential to combine all that data,
right,
which now technology allows us. I think the other opportunity from a patient experience perspective is personalization, right? So again, healthcare has started becoming more consumer driven. If you think about it, a few years ago, even now it's not as open an industry, right? We don't have that many consumer choices, but that is changing with small clinics opening up everywhere. So consumers do have more choices. There's a little bit of consumerism there. So I think personalization from that perspective is going to be important. That, as well as I think when you start to think about usually, right, when other industries are catching up and people are expecting technology. So that's another thing. A lot of it is like we as consumers, when we are shopping at an Amazon, we have certain expectations. We probably want the same experience when we're on a healthcare website, on a hospital website.
Right.
So I think a lot of that demand is also driving how you would use not only in the delivery of care, but in the operations how we sort of the customer experience and patient experience side.
Yeah,
and employee experience too, right?
Oh, yeah, for sure. I mean, a couple of decades ago, you might walk in and the doctor asks questions about your background. And now if you did that to someone who's under 30 years old and was born in technology, they would say, like, why are you asking me these questions?
Yeah.
Like, don't you have it right there? Like, there's an expectation. That's what you're saying.
Yeah,
and It sort of elevates and maybe even pushes the envelope toward where are we going to implement? How are we going to implement? Like, we've got to kind of keep up with the demand. Also, to your point on consumer, I had some kind of medical experience, and I heard them use the term customer for the first time. Is that a thing now?
It's not. I mean, I think we're trying to use that same learnings, if you will. So I think, again, healthcare can learn from a lot of different industries.
Yeah.
So I think if you say, customer, it's really patient-centric. So really patient in the center, and then everything revolves around that. That's typically the terminology, but I think it depends on if you're trying to learn and borrow ideas from other industries, that could creep in.
Yeah, I heard that, and I was like, what just happened? Why did that sound so strange?
Yeah. No, I think we deliberately would try to say, patient in the center. We want to be patient-centric.
Yep, gotcha. Okay, cool. So I would imagine that there are specific challenges. I told you I'd come back to something you mentioned about scans. So, I mean, because on the surface, you listen to all these different things that are happening and you think like, okay, yeah, I'll take two. This is great. Like, of course I want to improve patient experience. Of course I want better operations. Of course I want, blah, blah, blah. How do we get more of this? But it's not actually happening everywhere en masse, right? And it's not happening at scale. And some of it's not happening at all. It's more conceptualizing. So why? What are some of the, is there a little bit of fear too? Because you talked about scans, and there's a lot of talk about how AI can read scans better than people. And you talked about patient experience a good deal. Like, what are some of the big barriers that are specific to healthcare that are keeping us from gaining all these benefits?
Yeah, I think one of the things is data. I mean, there's just different modalities of data that you have to ingest, and you can. And healthcare data, is wide and shallow too. Like it's not, the data quality is not the best, as you would say. It's not, after all, human body is not, no two people are identical, right?
Right.
So I think, so that's a challenge. Just the data engineering and mapping data and getting data ready for AI is a huge thing. That's, I think, we're still working on that, right?
I think the human body is complex, and gathering that data. And then if you ask their opinions, a lot of patients lie. I mean, I read something about 20% or so. I mean, some crazy number of patients that just lie outright to their medical professional. So there's all these challenges with data itself.
So data itself, and again, obviously data is biased to people who come to the hospital, right? That's also another thing, right?
Course,
You're also already inherently biased to sick people, which again, that's what it is.
Yeah.
So I think data challenges. Then, of course, then you're making decisions for people. There's a fear also, right? You want to make sure that, because we've all heard about things where machines can go wrong.
Right.
I mean, I shared an experience this weekend. We tried the self-driving with Tesla, and it was cool, but it was creepy at the same time, right? And then at that point, you think about the human's still responsible. I mean, it can do crazy things, even though it was doing a great job. It didn't know the shortcuts. So, it would take, we put an address in the GPS, and it took us exactly, but there was a side road that we would typically take to go to that place.
Right.
It doesn't know that.
Right.
So I think some of those things, as you start to apply those to when you would want to put it into production, a clinical workflow, there's a lot of things we got to consider. So one of the things I think that healthcare in general, right, we're looking at or thinking about is how do you use AI as a tool to augment?
Not take the hand off the wheel.
Not take the hand off. It's human in the loop.
Right.
Use it for decision support. How does it make the human better and not replace the human, really essentially is the guiding principle.
Right.
Bias is, of course, another thing. Like you have to make sure that, we're offering equitable outcomes, and the data that you're training or the algorithms that you're training on, there's inherent bias in the society itself, right? I mean, we just got to figure that out and be more careful about that.
Yeah.
So I guess the severity of the outcome or the impact of the outcome is much larger.
Yeah, that's a good point. So it could mean community health, not even just one person. This colleague of mine, he's great. He works in western part of Georgia, and his number one data scientist had been a nurse. And so she was an RN, went back out of MSA, and she said it was because she felt like she could help more people, than one at a time. But that also means you can hurt more people, right? So if things are done wrong, or if something doesn't go like you wanted it to, it sort of it makes it larger, it makes everything bigger, more extreme.
Yeah.
So
I mean, there's also, there's definitely that. But I think on the flip side, right, there's also a possibility to identify and mitigate bias that humans can't recognize. So I think it's kind of using AI for the right thing, like, but not, to your point, not taking your hand off the wheel.
Right.
But making sure that it's as a human always, and the outcome that it comes aligns with how a physician, right, would also predict that. So there's one of the metrics that we always talk about is inter-rater reliability. So if you have a model giving you an outcome, if there are 4 people that'll give you the same, result, then yes, that seems like it's in alignment with what the education and the training of a clinician professional would be.
I
think there are different ways of kind of validating something, but yet still being skeptical.
Yeah, for sure. And that's what I was going to ask you is if you could envision like how it should be, because you don't want we talk a lot about the human in the loop, especially in healthcare, and you don't want the AI sort of just making the decision, but what would that look like in the right way with medical and healthcare decision-making that's sort of augmented with AI? What does that look like?
Yeah, so I think like some of the things would be, risk prediction. So one of the metrics that's often used in healthcare is what's the risk of a patient coming back to the emergency room after they have a surgery, right? So you usually measure, 30-day unreturns. And there are key parameters that would indicate that based on history or adherence to past, their medications or protocols, et cetera. If we could have that indicator up front, right, then you can actually do early interventions.
I see.
So I think it's kind of helping and augmenting that would be an example. Risk of not, again, if social risk could be helpful. So if we can predict that in advance or know that in advance to say, hey, this patient lives in a certain community or is exposed to certain social terms of health, can we circumvent those sooner?
I see.
So I think some of those areas it can really help with, or even images you talked about, right?
Yeah.
So if it can give a preliminary diagnosis,
right,
that then somebody
Not
has
a
to write up,
final-
and that's
yeah.
how I think it's being used, almost like a preliminary diagnosis, really. Whatever you do from an imaging perspective,
Right.
it looks like that. The other thing you could do is to enhance. I think it's a great way to enhance images. So what that helps is you don't have to expose that much sort of those rays. You don't have to go through X-rays again and again in that imaging, right? Because even if it's a poor quality X-ray, maybe there's an opportunity to enhance that without exposing the patient to more.
Right, exactly.
So I think there's some of those opportunities for sure.
I like that. I like that vision.
Yeah.
That's a good vision. Okay, cool. So is there a fear of AI? Like, because we're talking about sort of creating models with AI and then you sort of collectively use these models to make some kind of final decision. And the person is still using the decision. But is there a fear at some point that it's going to take the driver's seat or that it's going to eliminate jobs, or like, what do you think about that?
In healthcare, I don't think that's there per se, because I think it's still very, very early.
Yeah.
Maybe on the operation side, if you think of the other areas, I know there's some of that, but I don't think that's, in my mind, I don't think that's the right way to think about it.
Yeah,
right?
yeah,
and
yeah.
it's really is to think of
supporting
your buddy, right, as an
Right.
assistant, essentially.
Yeah, I know.
So
I've heard a lot of people in
I do
healthcare.
think we'll evolve. I mean, humans, I think the biggest strength of a human being is that we evolve.
We do.
So we'll evolve.
Right.
But I think it is this change that takes time. And I do think that the way we want to think about it is that it is really a tool and how it can help us enhance what we do and not replace what we do.
Right. I mean, I'm sure, like, how many carriage riders or drivers do you know? Like, I don't know any carriage drivers. Like, I'm sure there was a big fear about carriage drivers getting out of a job, and now here we are. But, like,
or we'll invent new jobs, right? That's the thing. That's the evolution.
Yeah.
So I think that it's going to take some time. But every time we have a disruption, right, that's going to be, that's going to accompany with fear too.
Right. Okay, very nice. What do you see as some of the very top types of opportunities? I'm sure you've thought of this, like in the community. So is it anti-disease type stuff, or is it like public health in some other way, or activities, or different mindset of how we care for our own selves? Like, what do you see if you had a silver bullet and you could go, here's where AI can really help us. Let's do this. If we could just do this one thing. Where do you see?
I think I would love to, that clinician burden, just what I'm hearing, right? Can we give back time to our patients, that human touch?
Yeah.
Because I think that's what my colleagues and whoever I've spoken to, right? One of the things, they come into medicine to actually help people.
Right.
And sometimes we create that burden that that's not what they're not spending as much time as they would want to.
Right.
That would be one thing. Of course, it's hard to rate because there's so much opportunity from a new cure, because I think it can really expedite research. We're talking about operations.
Right.
But I think it can really expedite research. So I was listening to, I don't know if it was NPR or Wall Street Journal, but one of the opportunities on the clinical trial side that they were talking about was, we have this control group, and then we have this group that actually gets the medication, right, in a clinical trial.
Right.
And the control group gets the placebo, if you will. But if AI could be used to predict the trajectory of a disease, then everybody could get the medicine sooner, the real thing, and you don't need a control group.
Right.
So I think, again, there's so much opportunity, right, to think about expediting and accelerating research as well that could lead to new cures. So I'm not sure about the silver bullet, but I am passionate about informatics in that way, that I love to see that time given back to the patient in some way and improve that patient-doctor interaction.
Right. So better, more improved, more accurate, deeper research that gets bench to bedside faster is probably one of your top. And then the second is the, what do you call it? The clinician burden?
Reducing clinician burden so we can give back time, like increasing that human touch back with the patient.
Yeah, I love that. Very nice. Any final piece of advice about leveraging AI technology in healthcare?
I think taking it leaning into it, not being scared of it, I would say, like not being scared, like trying and starting with pilots.
You think that's the biggest barrier?
I think one of the things is that either people are staying away or I also think not going very fast because it is
scary.
Something to think about, and having diverse perspectives. So I think it takes a full team, right? It's not an IT, it's not a business. You've got legal, you've got risk, so we need a lot of different perspectives when we're trying to implement something. So I would say, yes, let's make sure that our team has diverse perspectives before we're implementing something else.
Learn more, reduce the fear, and consider multidisciplinary approaches. That's very nice. I love it. Thank you so much to Bhavna Mehta, Assistant Vice President of Information Services Data Analytics. That's a long title. I have to look down to make sure I get it right. From Cincinnati Children's Hospital Medical Center, for talking to us about leveraging AI technology in healthcare.
Thank you, Beverly. This was fun.
Yes.